Kelly. Today I'm going to be showing you how to scoot a patient in a wheelchair and on a mat while maintaining precautions. Now I'm going to show you how to scoot a patient while maintaining total hip arthroplasty precautions. First, ensure that the surgical foot is in front of the non-surgical foot to maintain knee below hip. Second, assess shoulder range of motion so the patient can assist in unweighting the pelvis during the scoot. Next, ensure the patient is wearing a gait belt during the scoot so the healthcare professional can assist. And finally, instruct the patient to keep their shoulders over their hips to maintain precautions. Sam, are you ready to move? Awesome. Now the healthcare professional will stand behind the patient. Sam, can you place your hands on the armrests and push through your arms and with your good leg as we scoot forward? Place your hands on the gait belt to assist in the transfer forward. And on the count of 3, we're just going to scoot to the edge of the chair. Ready? 1, 2, 3. To scoot back, just do the opposite. Ready? 1, 2, 3. Now I'm going to show you how to scoot a patient while maintaining sternal and spinal fusion precautions. First, instruct the patient to avoid excessive bending or twisting at the trunk. Next, instruct the patient to hold the pillow across their chest as you scoot them forward. And then as I scoot you forward, lean into my shoulder. Finally, use either a gait belt or placement of your hands on the posterior side of the pelvis to assist in this scoot. Maintain correct body mechanics by having a wide base of support. All right, Sam, go ahead and lean forward, and then on the count of 3, we're just going to scoot forward, push with your legs. Ready? 1, 2, 3, and then 1, 2, 3. To scoot the patient back into the wheelchair, either place hands on the lateral side of the pelvis or utilize the gait belt. Now I'm going to show you how to scoot a patient who has hemiplegia or paresis. For this, it's important to first place the affected arm in a sling or in a gait belt like shown. This is important because we want to ensure we do not dislocate the shoulder during the scoot. Next, you want to guide the weak leg between both of the healthcare professional's knees without blocking the leg. Next, use the gait belt or placement of hands on the posterior side of the pelvis to assist in the scoot. And finally, instruct the patient to place hands on the armrest and then to push forward with the unaffected arm and leg. All right, count of 3, ready? 1, 2, 3, 1, 2, 3. Now I'm going to show you how to scoot a patient while maintaining total hip arthroplasty precautions on a mat. First, it's important to assess trunk stability so the patient can remain upright from static sitting during the scoot. Next, assess trunk to arm ratio so the patient is able to push through their arms to help unweight the pelvis during the scoot. Next, ensure that the surgical foot is placed in front of the non-surgical foot. And finally, utilize a bilateral scoot with either the gait belt or placement of the hands on the posterior pelvis to assist in the scoot. Sam, if you could place your arms down on the mat like this, and then when I scoot you forward, help push. Maintain a wide base of support for healthcare body mechanics. All right, on the count of 3, ready? 1, 2, 3, scoot. 1, 2, 3, scoot. Now I'm going to show you how to scoot a patient while maintaining spinal fusion precautions or sternal precautions. For this, it's important to first ensure that the patient has trunk stability to maintain an upright position during static sitting. Next, instruct the patient to avoid excessive bending or twisting at the trunk. Next, give the patient a pillow to place across their chest and cross their arms. Finally, ensure the patient is wearing a gait belt to assist in the transfer. During this, instruct the patient to lean forward close to your shoulder and push with both of their legs during the scoot. Place hands on either the posterior side of the pelvis or on the gait belt and maintain a wide base of support during the scoot. Sam, on the count of 3, ready? 1, 2, 3, scoot. On the count of 3, ready? 1, 2, 3, scoot. Now I'm going to show you how to scoot a patient with either hemiplegia or paresis on a mat while maintaining precautions. First, it's important to assess trunk stability so the patient can maintain an upright position during the scoot. Next, it's important to place the affected arm in a sling or in a gait belt like shown to ensure the shoulder does not get dislocated. Next, guide the affected leg between the healthcare professional's knees without blocking it. And finally, use either the gait belt or placement of the hands on the posterior side of the pelvis to scoot the patient forward. Instruct the patient to place their unaffected arm on the mat beside them to help push forward.